Healthcare reform has been proposed several times in American history, but it's failed 5.5 out of the 7 times it's been proposed. Since 1912, presidents like Teddy Roosevelt have been fighting for it for our country. Since we're the only industrialized nation without it, what's the current policy on the table right now?
In 2006, 43 million Americans were without health insurance. Over half of these people cited the inability to afford it as the reason why. Members of the Democratic Party have suggested a public option in order to help these people afford health insurance.
The Republican Party believes that allowing individuals to go across state lines to purchase health insurance and allowing businesses to pool together to purchase health insurance will help lower costs.
The Democratic Party has suggested tax credits for small businesses and individuals to help people afford health coverage.
The Republican Party has suggested allowing employers to reward employees who have healthy lifestyles.
While the Democratic Party agrees with preventative health care measures, they have also cited frivolous medical malpractice suits as a reason for insurance costs being so high. They have suggested reforms to help this problem.
Republicans agree tort reform is a great way to cut costs, and we have 2 models in Texas and California to make it very effective.
What about the libertarian viewpoint?
Good question. The libertarians believe that limited government involvement is the best way to lower prices, as we allow individuals to purchase what they need.
Well, I'm a U.S. student. I know healthcare reform would affect insurance and taxes, but what would it do for me?
Good question. Healthcare reform will do a lot for students at the University of Florida. For one, a very important aspect for students attending here is the age for which you can be dependent on your parents' insurance will rise from 22 to 26 years old, which will allow for some flexibility when it comes to your insurance. Another aspect that will affect University of Florida students is that there's a possible fine for not having any insurance, and therefore insurance companies will create programs to treat 26 years and younger people for a low-cost insurance plan. Finally, another thing that can affect UF students is many students here get part-time jobs while they're working here, while they're attending here, and if certain companies believe that they have to pay more for health insurance for these part-time workers or face a fine if they don't pay for health insurance for these workers, some may not hire as many part-time workers, and therefore could affect the job hunt for some UF students.
Well, what can I do to get involved?
Well, you can contact your local representative, Cliff Stearns, at 202-225-5744. Or you can go to stearns.house.gov. Or you can go to readthebill.org, keyword healthcare.